Hi, so today I'm going to talk about Ehlers-Danlos syndrome, or EDS, which goes along with my disease POTS, but I don't have EDS, but most people with POTS do have EDS. It goes hand in hand. So Ehlers-Danlos syndrome is a group of connective tissue disorders that can be inherited and are varied both in how they affect the body and in their genetic causes. They are generally characterized by joint hypermobility, which means that their joints can go back further than normal people. Skin hyperplexity, and the skin can be stretched in abnormal ways, and tissue fragility. So EDS, there are currently 13 subtypes. Each EDS subtype has a set of clinical criteria that help guide diagnosis. A patient's physical signs and symptoms will be matched up with the major and minor criteria to identify the subtype that is most complete fit with it. There is a substantial symptom overlap between the EDS subtypes and other connective tissue disorders, including hypermobility spectrum disorders, as well as a lot of variability. So a definitive diagnosis for all EDS subtypes when it comes to gene mutation is known. All the hypermobile EDS are also calls for confirmation by testing to identify the responsible variant in the gene affecting the subtype. So every person who has EDS, it's their own experience. EDS is different. It is different in every single person, and it affects every person differently. So the clinical symptoms of EDS are joint hypermobility, skin. The skin tends to be soft and velvety-like, and hyperextensive, so you can stretch it really far. Fragile skin, so it's easy to bruise or tear easily, and it can also rupture. Scoliosis at birth and sacral fragility is also really common with people with EDS, and they usually have poor muscle tone as well. They can also have mitral valve prolapse in their heart. The less common symptoms of EDS can also be the really debilitating and chronic parts. So musculoskeletal pain, so that is caused by the hypermobility of the joints. It can cause pain and have them flare up, and the organs around can also become inflamed. So it kind of affects every single part of your body, even though it's not just in your joints. It can be in your whole entire body just because your joints and your muscles are flaring up. So the connective tissue that the body has is it provides strength and elasticity to your bones, so they can move in certain directions, move up and down, move side to side, and everything. And in normal people, it can be stretched, but not to a certain limit. Like, it stops at a certain limit. That's how some people are more flexible than others. But with people with EDS, they're able to like bend their fingers to touch their wrist, or stretch their skin all the way out. So it's very different, and it is an interesting disease, and it's also a pretty invisible illness as well, just because it doesn't have a lot of physical, you can't really like see somebody walking down the street and know that they have EDS. So how Ehlers-Danlos is diagnosed, it's kind of just done on a spectrum. So depending on how hypermobile you are, it really is a telltale sign whether you have EDS. That's the easiest sign for people to diagnose it with. It's also not a very common disease, so it's also one of the ones that people don't necessarily know about, which means some doctors are not too familiar with it as well. So Ehlers-Danlos syndrome, it happens in 1 in 2,500 people and 1 in 5,000 people. So it's more common than people think it is, but it's not always diagnosed correctly. It's not always diagnosed fast because it doesn't manifest in some people till later. So the prognosis for people with EDS is they can live a normal life expectancy, but there definitely can be issues with their organs going down the line just due to the inflammation. So that is something to watch out for, but they definitely can live a full and healthy life.